Welcome to the Jaco Report. I'm Charles Jaco. 20 Republican-led states, including Missouri, are suing to declare the Affordable Care Act, also known as Obamacare, to be unconstitutional. The problem is they have nothing to replace it. So if the Fifth Federal Circuit Court of Appeals in New Orleans declares the ACA unconstitutional and the U.S. Supreme Court agrees, people who have Obamacare coverage would face having their medical insurance eliminated. Insurance companies would once again be able to deny coverage for pre-existing conditions. Young adults would no longer be covered by their parents' insurance, and there would probably be chaos. Now, the Missouri part of the lawsuit to overturn Obamacare was started by Josh Hawley, who was then Missouri's Attorney General and is now, of course, Missouri's U.S. Senator. We asked for a comment from Hawley for this program. His office never answered our inquiries, but he did talk about it 11 months ago while he was running for senator in this story from reporter Michael Mahoney of Kansas City's KMBC-TV.
Hawley and Missouri joined with 19 other states in a lawsuit to strike down the rest of the Affordable Care Act, Obamacare. The suit says since the insurance requirement is now gone, the whole law is illegal. But he wants to preserve the provision that insurance companies must cover people with pre-existing conditions.
I think we ought to require insurance companies to cover folks with pre-existing conditions. Wow. I think we ought to cover, you do it as you mandated. You say you have to cover them with pre-existing conditions.
He did not elaborate on how to draw up that mandate.
Hawley never did make clear how that would happen. In October of last year, he appeared on Meet the Press.
But as you know, if you get rid of this law, you also get rid of the protection on pre-existing conditions. I know that you believe it can be passed, but frankly, it never has been, as you know. In your lawsuit as Attorney General you filed, you could have severed the issue of pre-existing conditions. How do you plan on protecting pre-existing conditions?
You know, Chuck, I think that we can do, there are a number of ways to do it. To protect folks with pre-existing conditions, Congress should mandate it. My position is insurance companies should be required by law to protect folks with pre-existing conditions. My own son, I've got two little boys at home.
Do you think that's constitutional, by the way?
I do. Oh, yeah, I do. Absolutely. I do. What's not constitutional is the requirement that people buy health insurance they don't want. But it's absolutely constitutional to say that insurers have to cover people with pre-existing conditions. Congress should mandate it. People like my own little boy who has a pre-existing condition should be covered under the law. But apart from Obamacare, we don't have to have Obamacare to do it.
But that is not true. For 10 years, the GOP in Congress has complained about Obamacare, but has never come up with any plan to replace it. Eric Schmitt was appointed to be Missouri Attorney General after Hawley was elected to the U.S. Senate. Schmitt, like Hawley, is arguing in court to get rid of the Affordable Care Act. We also asked Attorney General Schmitt why he continues Hawley's lawsuit when the impact of getting rid of Obamacare would be so great for so many Missourians. Schmitt, like Hawley, never answered our inquiries. Joining us today are two of the nation's leading healthcare policy experts who also happen to be St. Louisans. Tim McBride is a health policy analyst and economist at Washington University's Brown School of Social Work. Thomas McAuliffe is Director of Health Policy for the Missouri Foundation for Health. Welcome to you both. The three of us, have been talking about this for a decade now, since Obamacare was first proposed. Yet, here we find ourselves again. Let me ask you both the same question. Thomas, I'm going to start with you. Assuming that Missouri and the other states succeed and the ACA is overturned and it's upheld by the Supreme Court and they declare the whole thing unconstitutional, what happens?
What happens? Hundreds of thousands of Missourians find themselves in the process of either losing their insurance or uninsured. I mean, right now we talk about the underinsured. We'll be again speaking about the uninsured. The access to care. When we think about having insurance is the number one predictor of access to care. And that adversely affects communities of colors, individuals of color, low income. So what we think will happen is a further extenuation of the disparities that we see arising out of lack of access, lack of affordability, and lack of insurance.
Tim, same question for you. If they succeed and the whole thing is tossed out, what do you think happens?
I would agree with everything Thomas said, but I would add to this that repealing the entire Affordable Care Act, which was about 1,000 pages, is not only just these coverage aspects, but would include so many other things. It included expansions of coverage to dependents who are 18 to 25-year-olds who now have access to it while they're in college. It includes things like closing the donut hole for people on Medicare Part D. It includes, expansions for Medicaid, and the marketplaces would go away. It includes a lot of other things like expansions for workforce expansions were put in the marketplace. The Affordable Care Act had 10 titles in it. And one of the things that I would point out to you is that the healthcare sector is about 20% of GDP. And the only thing that was recession-proof in the last recession was the healthcare sector. The jobs have been growing throughout the whole period, and we would probably see a remarkable drop in the number of jobs too.
So the impact of this being declared unconstitutional, would it be complete chaos in something that makes up 20% of the economy?
There would be a big change in the insurance industry for sure. There would be a big shakeup in the managed care industry. There would be a big shakeup in the insurance industry, probably not for private sector insurance, but everything related to Medicaid and Medicare insurance. But there are a lot of mandates we haven't mentioned. We'll talk about it, I'm sure. There's a lot of insurance reforms in the Affordable Care Act, doing away with pre-existing condition exclusions. That would go away as well.
Okay, go ahead.
I was going to say, I think if you're going to think about economies, think of household economies. Right now, households are able to purchase insurance. This law made it possible that everyone would have an offer of insurance. If you took that away, what then happens to the household economy? What happens to a family that plans on being able to pay for a sickness because they have insurance, or a sick child, or caring for or insuring their child until the age of 26? So there are a lot of decisions that are predicated on having insurance. You take that away, those decisions aren't as clear.
Okay, Tim, hypothetically, I'm a person who has Obamacare coverage. This thing is declared unconstitutional. What happens to people like that? Do they automatically lose their coverage? The rug is jerked up from under them because the method through which they got their insurance is now unconstitutional? Or do we know?
I don't think we know. We've never been in territory like this before. And the truth of the matter is the way people have gotten Obamacare coverage is probably mainly two routes. Through a Medicaid expansion is one route, and that's actually probably about 2/3 of the people. And then about 1/3 of the people have gotten it through the marketplaces. So that would unravel. And, I don't think we've seen anything like this happen that would affect probably close to 20 million people who would eventually lose coverage, perhaps. That's what the CBO suggests, 17 to 20 million people in the United States. So the marketplaces theoretically would go away. The Medicaid expansion would roll back. And so I would expect, I'm just hypothesizing this, that the federal government and the state governments would have to have a ramp down of these things and say, it can't probably happen overnight, but maybe it would happen overnight. They'd probably have to say marketplaces would close in X number of months. Medicaid expansion, you got it until, June, and then you're done. As a matter of fact, we've seen 100,000 drop in Missouri anyways in Medicaid expansions, Medicaid coverage, but that would happen all over the United States.
I wanted to talk about that in a minute, but Thomas, first I wanted to ask you, what about Hawley's campaign rhetoric that, oh no, let's keep the good parts of Obamacare. There is some sort of unspecified federal law we can pass that will mandate 18 to 25-year-olds still be covered under their parents' insurance policy and will mandate coverage of pre-existing conditions. I've never seen anything like that proposed by the Republicans. They haven't gone near it. Yet Hawley kind of blithely assumes a law will be written and that will all be taken care of. Talk to me about the reality of that.
Well, I think the reality is we saw how hard it was to pass the Affordable Care Act. The reality is that there aren't a lot of plans out there for replacing. I think that's what Tim is pointing to, is that we're not talking about a plan that steps in to extend coverage, to care for, or to think about the people who are currently in, what's euphemistically known as Obamacare. The fact of the matter is Obamacare is a marketplace where people buy insurance. It's no different than when your employer buys insurance. It's not a gift. It's something you purchase. And the great thing about the Affordable Care Act was allowing for and affording that access as well as supplementing that purchase. So when we talk about blithely, pushing through a law that protects all the good parts, quote unquote the good parts, because I think Tim and I would agree those aren't always the best parts. Some of the best parts of the law are things that we don't even see: value-based purchasing, outcomes, etc. But pushing through a law like that keeps these best parts is highly unlikely, because insurance companies are companies, and that's why I think Tim is right about the ramping down, is that the big insurance companies have planned for this for years. They execute the marketplaces, they participate, they price, etc. Just all of a sudden saying, oh, that business model doesn't work anymore, I would love to know how the insurance companies could actually do that. So pushing through a piece of law, legislation or a law like that is highly unlikely, because one of the problems that we often heard during the election was Nancy Pelosi had said we need to pass the law to know what's in the law. And I think her point was it was so nestled. This is 20% of our economy, and it's so complicated, and it has an impact on every single American. And getting rid of it and then trying to pass something that is light is likely to not be successful, likely not to pass, and what we know is it's not going to have the intended health outcomes.
So are we going to have quite literally millions of people whose health insurance is suddenly taken away and they find themselves uncovered and they're basically forced into emergency rooms to get coverage, or would it be that draconian, or do we know, Tim? What would happen? Would the rug just suddenly be pulled out from under 20 million people and they would wake up one morning and say, oh, you're not insured anymore?
Think about what the world was like before 2014. That's the world we would face. And probably most importantly, and this was a big issue in the 2018 campaign, no pre-existing condition exclusion protections. So people who have cancer, who have diabetes, who have migraines, they would not, all of a sudden their premiums would go, they wouldn't be protected when they go to buy insurance. So all of a sudden that would happen again. So if you go to buy insurance from Aetna or United Healthcare, you had to go buy that by yourself, and your premium could be $20,000 a year, $25,000 a year, or you would be denied coverage. That would happen all over again. People not in Missouri, but in places like California, Illinois, New York, they would lose all that Medicaid coverage.
All right, so let's talk about Medicaid coverage. And a lot of people are confused about this because in the ACA, in Obamacare, there were sweeteners so that Medicaid coverage for low-income people could be expanded. Missouri refused to do that. You said Missouri has been saying that tens of thousands of people have dropped off the Medicaid rolls. The spin on that is that the economy's improved so much they're not on it, which is obviously a lie. But what is the truth? What's happened by Missouri's refusal to expand?
Well, so I chair the Medicaid Oversight Committee, at least until next week. And and the truth of the story is I don't buy the economy explanation either. It's a little part of the explanation, but the main explanation, it's complicated, but the main explanation is they went through what's called the redetermination process. And so people on the rolls, they need to redetermine whether they're actually eligible. And for a set of complicated reasons, we have a very antiquated computer system in Missouri, and they haven't done this for many years, and they started to do it about a year ago. And so they've been processing several thousands of people every month. And they went through them and tried to determine whether they're eligible for Medicaid or not. And some people, they said they are and left them on the rolls, but a number of people they couldn't determine. They sent them a letter in the snail mail. And now you can see what the problem is, because a lot of people who are low income don't have snail mail addresses. They don't have the right addresses for them. Hardly anybody uses that anymore, and that fell through the cracks. We've lost 100,000 more people on Medicaid, 85,000 children in the last year and a half. And so 20,000 of them are parents, 85,000 of them are kids. That's where I don't believe the economy explanation, because we shouldn't be losing 85,000 kids, because kids are still eligible up to 300% of the poverty line.
How much of this, and this is a question for both of you, is bureaucratic foul-ups and antiquated computer systems and the left hand not knowing what the right is doing? And how much of this is sort of ideological revenge? In other words, you know, here's the undeserving poor, they're the makers and the takers, these people are sucking us dry, we're going to cut them off at the knees and remove their Medicaid benefits and thereby declare victory. I mean, how much of it is sort of ideological retribution and how much of it is just bureaucracy?
I'd be curious to see if you've been hands length from this. I'd be curious
what do you
say.
think?
Then I'll jump in too. So.
Well, I appreciate that handoff, Tim. What I'm going to say is that the politics of it, we tend not to think about it. We're a nonpartisan organization. What we look at is the impact, and the impact on families and children, the impact on working Missourians. So when we look at what 100,000 dropping from the rolls looks like, when we look at what an antiquated IT system or the rhetoric of this is all good, there's nothing to see here, keep driving, we are looking at the health outcomes of rural communities across the state most in need being denied. Families that need it most being denied. And those have repercussions down the system, from rural hospitals closing to asthma incidences to increase ER visits. So what we tend to think about is on one side there's a decision and it has exponential impacts across the system. And those exponential impacts are higher cost, lower value. And when we engage in all of this rhetoric about the mailings and about all of this, we're losing the sight of the people, the citizens of Missouri who are most in need, 80% of whom have a job and cannot get enrolled or cannot get insurance. We're talking about adults in other states who are eligible who can't get Medicaid in our state. And they're functionally uninsured. I mean, and the threshold for that is $3,000 a year. I mean, so when we think about what our Medicaid system looks like, we have to look at the reality of what it isn't. And what it isn't is serving the citizens of Missouri.
Okay, Tim, same question for you. I mean, how much of this is ideological retribution because you're poor, therefore you're undeserving, and how much of it is just bureaucracy?
I would tend to say it's mostly the latter. I mean, I sat in the oversight committee for the last year, over a year, beating up on this issue, and I'm probably the biggest critic in the state on this issue. And frankly, I think it's just a series of unintended effects that started with this bureaucratic snafu around the computer, and then you just have a lot of other things that happen with bad call center. So, you know, I can't get in a person's head to know whether they really intended for 85,000 kids to go off, or 100,000 people to go off the Medicaid system. You know, I don't have the smoking gun to say that that's what they wanted, but I think they triggered an event of looking at people's eligibility, and then a whole bunch of other things happened that made this happen. And then they were like, whoa, this all happened. And then people, you know, they're dropping off the rolls, especially the kids. I'm not sure if they really intended 85,000 kids to drop off the rolls.
So what happens? You've got 100,000 people, 85,000 of whom are children, who are no longer eligible for Medicaid. Does that mean they are effectively without any health care? Did they have to use ERs? I mean, what's the situation?
So, you know, I've been asking that question. You know, I keep asking that question, not getting that answer, but I'm starting to get...
But no one knows?
I can't get an answer to that through the Medicaid Oversight Committee, but I'm starting to ask that of the healthcare systems. And just a couple weeks ago, I asked a healthcare system, and I've been hearing that they're starting to see a 5 to 10% drop off in their revenues from Medicaid. So yes, you know, that was what I would expect, is that these people who used to come in with Medicaid coverage are either not coming in at all, or they're coming in as uncompensated care, which means, you know, we're back to the 2013 period, so the system is losing money. And that's happening to all of our hospital systems and all of our providers.
Going back and pulling the lens back to look at the wider issue of getting rid of the ACA. And we can argue all days about the motivation for this, whether it's smart policy or whether it's just retribution against Barack Obama. But Thomas, from your point of view, from a policy point of view, do you think the push to declare the ACA unconstitutional is taking into account seriously what the effects might be, and might be pretty quickly, or do you think people seem to be plowing ahead looking at this as just, sort of an ideological / political case to win, and they're not looking at what the consequences are going to be?
Absolutely the latter. I think that people are plowing ahead, not thinking of a replacement, not thinking of what happens. If we replace the Affordable Care Act with nothing or something that is close to nothing, we are not thinking about what we've preconditioned the economy, preconditioned communities, preconditioned individuals, and how they think about health and healthcare access. I mean, Tim didn't mention, and I've heard him speak about this before, but there used to be caps, lifetime caps on care. So when we talk about cancer, when we talk about some of these serious cost-intensive treatments, now there are no lifetime caps. Now you get that treatment. What happens if you're midway through a course of treatment and all of a sudden the rug is pulled out from under you? Do you look at the doctor saying, no more treatment? Do you think about not being able to afford insurance? Does your employer, who decided to shift everyone to the marketplace, all of a sudden say, well, we were offering insurance for you to purchase in the marketplace, now nothing? So my point is I think we're thinking about health from a political perspective, and we're not thinking about it from an outcome perspective. We're not thinking about the people who need this most. And it's really easy for us to say, oh, this is low income. But the fact is that increasingly, this is middle class income. These are families who are purchasing through the marketplace, or their employers are purchasing through the marketplace, because the cost of insurance had gotten so ridiculously out of whack. So the ACA, for all its critics and all its issues, has done a very good job of what it was intended to do: getting people insurance. And if you take away that mechanism, then what do? And in America, insurance is the #1 step to getting access to care.
Final question for both of you. This opens the door to the larger argument of what kind of healthcare system the United States really should have. Has the ACA, and then what came before it, and the experience we've had, shown us whether or not proposals for single payer, aka Medicare for all, would make more sense, whether something like this makes more sense, where a totally privatized system where you're dependent on your employer for insurance makes more sense? I mean, has it shown, give us any lessons about what may be at the end of the road the best way to go, Tim?
Oh, I think that's absolutely right. I mean, this debate, and we're about ready to have that debate in this presidential campaign about, because they're, at least on the Democratic side, they're having that debate right now. There are, among the circles that I talk to, some people say, well, we should just abandon this and go to single payer. The truth of the matter is, as Thomas mentioned earlier, this was incredibly hard to pass. If you look at the history about how the Affordable Care Act was to pass, this was just barely passed by the skin of its teeth, and it took 100 years to pass the Affordable Care Act. So, the real politic answer to this is that incrementally the Affordable Care Act probably needs to remain in place and change it. Most health policy analysts would probably tell you that we need to move towards some sort of single payer type system, whether it be Medicare for all, but that's not going to probably happen in our political system. So, the other thing I would tell you is I've been in health policy for 30 years, and every major piece of legislation is followed by changes to the legislation. They pass, 4 or 5 bills that fix the legislation. The odd thing about the Affordable Care Act is it passed, and then they refused to pass legislative fixes to the Affordable Care Act. every person, Thomas would have his list of 20 fixes to the Affordable Care Act. I would have my list of 20 fixes. There was bills ready to be passed. So none of us would say it was a perfect piece of legislation. So if we could pass the fixes to the Affordable Care Act, including public option, other things, you know, that's probably where we need to go, is let's just build on what we have and then fix it.
Thomas, same question for you. Does this give us any indication about, at the end of the day, what sort of system might be able to deliver the best health care at the most reasonable price for the vast majority of people?
I think of the Winston Churchill quote about Americans only doing the right thing after they've exhausted every other option. Well, we've exhausted every other alternative. I think that we are now in a place where Americans are on the precipice of having to have this discussion that Tim alludes to about a single payer.
So we might be in a position where we're going to have to choose, and choose quickly, single payer or something like that.
I don't think we have a choice. This system that we have right now does not work. The ACA was a really good attempt to fix. It was an attempt to work with the tools we had, or the levers we had. But the private system as it works now, and the delivery of care as it works now, with the outcomes that we get now, is untenable. And I think as a nation, we are going to have a discussion about cost. We're going to have a discussion about outcomes. And I think something we haven't talked about much here is we have an aging population with a lower tax base. So the fact of the matter is that the money that we have to put into healthcare is diminishing in many ways, and that creates scarcity. And Tim, as an economist, will say scarcity is the bread and butter of economists.
Thomas McAuliffe, Tim McBride, thank you very much for being with us. We appreciate it. Our thanks to Thomas McAuliffe and Tim McBride for joining us, and our thanks to you too. We hope you can join us. You can join us back here next week for another edition of the Jaco Report. We'll see you then.